Good evening. Welcome to another edition of DeBakey CV Live Innovation on the Loose, streaming live from Houston Methodist Hospital here in the Texas Medical Center. I am Dr. Stuart Corr, Director of Innovation Engineering for the DeBakey Heart and Vascular Center. Now tonight we touch on sepsis mitigation and how a local team of innovators and creative thinkers are tackling the problem using our extracorporeal blood filtration system. To that end, my guests tonight are Dr. Sinead Miller, co-founder and chief executive officer of PathX, and Alex Wieseler, co-founder and chief operating officer also of PathX. Now, before we proceed, I'd like to invite the audience into our discussions. So please submit your questions via web at polev.com using DeBakey as the username, or text DeBakey to 37607 alongside your question. Now you can also add your question into the live YouTube stream. So let's kick things off. Sinead, Alex, welcome to Innovation on the Loose. It's great to have you on the show tonight.
Thanks, Stuart. Stuart, really happy to be here. Thanks for having us.
No worries. So listen, I'll hand it over to you, Sinead. You know, what is PathX? What are you guys doing here in the Texas Medical Center? I'm sure our audience will love to know a lot more.
Excellent. Thanks, Stuart. And yeah, we're really looking forward to diving in and sharing more about what we're doing, what we're working on here in the Med Center. Is it okay if I go ahead and share my screen?
Definitely.
Excellent. Okay. Let me pull this up here. Hopefully you can see everything clearly. Just the front page here is the PathX logo. Is that looking okay on your end?
Looks great.
Excellent. Okay. Well, yeah, again, just want to start off by saying how thankful we are for this opportunity. Houston Methodist, such a world-renowned facility group. And so just really thankful to have this opportunity and looking forward to sharing more here. So at PathX, our mission is purifying life through the diagnosis and treatment of sepsis. Our technology is a breakthrough technology that we've proven can capture and remove over 99% of bacteria and endotoxins from the bloodstream, regardless of bacteria type or even drug resistance. And we're using this technology for the diagnosis and treatment of sepsis. What's really, really great about our technology is it's simple, it's very effective, it's unique, and we've also proven the safety of it, which we'll dive into more later. But before we get started, I want to just give a quick overview of the problem with sepsis before we jump into the technology. So I know a lot of people are familiar with this, but let's dive in here quickly. So sepsis, is a life-threatening organ dysfunction caused by infection. It's an enormous problem. Sepsis affects 1.7 million people in the US per year. It's estimated sepsis affects 50 million people globally per year. We know it's the leading cause of death in our ICUs. Sepsis worldwide will cause 1 in 5 deaths. The readmission rate is very high. It's the highest cost on the US healthcare system. And there's a lot of common precursors that can lead to sepsis. Cancer being one if you're immunocompromised, pneumonia, dialysis, burn trauma. A lot of these things can lead to sepsis. Even just personally, a few years ago, my father got sepsis from a perforated GI tract. So a lot of different things can lead to sepsis, but in the end, it's very difficult to treat and can be deadly. And there's a number of reasons for this. Sepsis is, like I said, difficult to diagnose, difficult to treat. For every hour that a patient with sepsis is not properly treated, their risk of death increases by about 8%. And the reason why this is so important is, it takes 3 to 5 days just to identify what bacteria a patient is infected with to treat them with the right antibiotic. So this makes things very difficult. And then on top of that, we're really limited with our treatment options. We have broad spectrum antibiotics, but there's the growing concern with multi-drug resistant bacteria. We have the delay with bacterial identification, and then on top of that, there's, the drug companies, pharma companies aren't super incentivized anymore to develop new antibiotics. So all these things really, really are a problem. And so that's where PathX is jumping in, and we're developing a technology to help with the diagnosis and treatment of sepsis. And here, before I go on, I just kind of I just wanted to give a little background about myself and how we started the company. So me personally, I wasn't, earlier in my career, I wasn't an entrepreneur. I wasn't in the med device field. I was actually a professional cyclist, a road cyclist. I've cycled my whole life. Started racing since I was, 4 years old. Loved cycling. Thought that that's what I was going to do for a career path. But when I was in my early 20s, I had a bad head injury while I was racing in Europe. I had a TBI. And I really had a difficult time with that and recovering from it, and still suffer from, problems from that today. I've gotten a lot better, but, the first few years were really difficult. And through that, realized I wouldn't be able to race again. I wouldn't be able to cycle again. So I needed to do something different, have a different career path. And so through all that, through the TBI, I really started to understand that there's not a lot of treatment options for people with a TBI. Really, all that you have is, time, you just have to take time to try to get better, but there's a lot of unknowns and uncertainties with that. And so that really inspired me to get into biomedical engineering, because I wanted to do something where I could potentially make a positive impact on people's lives and help develop something that could potentially treat patients that don't have many treatment options. So I got into BME, went back to school, went to Purdue in Indianapolis, got my undergrad, went to grad school at Vanderbilt. And then while I was at Vanderbilt, I was on this project for my PhD to develop iron oxide core nanoparticles that can capture bacteria, multi-drug resistant bacteria, from whole blood. And the reason for this is because a lot of troops from Iraq and Afghanistan were coming back with these multi-drug resistant infections. And so I was working on this grant to develop these particles, and we did develop them successfully. And then I did some computational modeling to see what it would look like to scale up this nanoparticle based approach to treat an entire human's blood volume. And with that computational modeling, I realized that because of the limited magnetophoresis of these nanoparticles and because of the bacterial doubling time, it wasn't really going to be possible to effectively treat an entire patient's blood volume fast enough to have a positive effect. So that's whenever I came up with this idea to pivot and use inertial base force to focus and separate bacteria from whole blood based on their size and shape. We developed a small device, lab on a chip type device with this technology, saw that it worked at a very small scale. So then from there, submitted for some grants, got some grants in, and were able to start the company. And so that's kind of the early stages of PathX. And it's been a long road, but now we have what you kind of see here on the side of the screen, which is our device, which is, it looks and feels like a hemodialyzer. It can plug and play into hemodialysis machines, but rather than treating renal failure, we're treating sepsis through capture and removal of the bacteria from the bloodstream. So like I mentioned before, we've been able to prove that we remove over 99% of your gram-positive bacteria, gram-negatives. And it's important to note too that we very effectively remove endotoxins directly from the blood. And this is important in cases of endotoxemia. And then on top of that, because of our technology, we can treat multi-drug resistant infections with the same effectiveness as drug susceptible bacteria. And I'll get into the details a little bit more here in a couple slides with an animation to show how the device works and looks. But just as a high level before we jump into that, in general, we're using inertial force to separate bacteria from whole blood based on the pathogen's size and shape. Our channel, the blood path, is actually completely hollow, which is very, very different than your normal hemodialyzers. We are not using a porous-based membrane system. And with this technology, with this hollow channel approach, we really have the ability to have no negative effects on healthy blood components. We don't remove additional blood components. We only capture and remove the bacteria and endotoxins, the very high efficiency in a single pass. And another big bonus point of our device is that you don't have to identify the bacteria prior to treatment with the PathX device, because as I mentioned, we're capturing and removing drug susceptible bacteria with the same efficacy as drug resistant pathogens. So this next slide here kind of just shows the workflow. We connect our device with a common hemodialysis machine. We use very similar flow rates. We use the same blood lines. So if you took our device, the inlet and outlet ports would be identical to what you would see on a hemodialyzer. And then as the blood flows in, we use our inertial force and a selective coating to capture and remove the bacteria and endotoxins. And then the blood flows back into the patient continuously. And this is done over, for example, a 4-hour period consecutively, similar to what you would see kind of in hemodialysis. So, Stuart, if you wouldn't mind, we have an animation that maybe you can show from your end. I think it might be a little bit clearer.
Playing it now.
So excellent, thank you. Again. Perfect. I see it there. So in this animation, basically how it works is the blood flows into the inlet of the device. Here in this animation, bacteria are represented by your green cells, healthy blood is represented by your red cells. And then we use inertial force of our helical channel to focus bacteria along the outer walls of the channel itself. And then on top of that, we functionalize the channel walls with a ligand that binds and captures to the outer membrane of the bacteria. It also binds to endotoxin, capturing them, allowing us to then flow clean blood right back into the patient using a method very similar to what you would see with hemodialysis. Excellent. Thanks, Stuart. I can take back over the slides if that's okay. Awesome. Thank you. So, that animation is, it kind of shows how we're using inertial force on top of the ligand, which actually binds to the outer membrane of the bacteria themselves. And this is really a revolutionary approach. I mean, having this hollow channel has a lot of benefits. We're not having any indiscriminate capture of healthy blood cell components. And in this way, we can capture whole bacteria because we're not limited by pore size exclusion mechanisms. And we have a very high capture efficiency, and the total bacterial load that we can capture with a single device is 3 times greater than the amount of bacteria that you would ever see in your most severely septic patient. Additionally, with that, by removing the bacteria from the bloodstream, you can prevent the distal dissemination of bacteria to other organs. Like I mentioned, we don't need bacterial identification prior to using our device. We're not removing antibiotics, so that's very important in the case of treating sepsis patients, because you do not want to be filtering out antibiotics that the clinician is giving to the patient. So with our device, because it's completely hollow, it's not porous, we aren't removing any drugs or antibiotics that the patient is being administered. Whereas a lot of other competing technologies would suffer from that with a pore space separation system. And so I just want to talk briefly about some of the studies we've done to date. So we're an early stage company, and up to this point, we've completed bench testing and we've completed large animal testing. And so we've developed a large animal model of sepsis. And we've been able to prove in this model that we can clear over 99% of gram-positive and gram-negative bacteria from the bloodstream in 1 hour. We've proven the very large bacterial capture capacity of our device, and we've also proven the endotoxin binding capacity. These animal studies were really impactful for us because we were also able to see in real time how our device would allows for improvement of the mean arterial pressure compared to the control group. And even on top of that, by removing bacteria from the bloodstream with our device, we were able to reduce the bacterial load seen in distal tissue, like your liver, lung, kidney, spleen, as compared to the control. Stuart, does that all make sense to you, or did you have any questions to jump in here?
No, this is going great. Yeah, I've got a few questions, but I'll leave them for the end.
Excellent. And one more thing I just want to mention that I think a lot of times gets overlooked when looking at different extracorporeal filtration devices is the priming volume. So our priming volume is very low compared to other competing devices or other hemodialyzers. Our priming volume of our device, so the volume of blood in the device that it can fill with is 24 mils of blood. That's very low compared to others. Other devices, have a priming volume of about 100 to 150 mils. And the reason why this is important, and we took this into our design consideration, is because it's difficult for a sepsis patient to have a lot of blood outside of their body at any given time, because a lot of times they're unstable. And so having this low priming volume allows us to have a very low volume of blood outside of the patient's body at any given time, and which gives us better control, and really results in no instabilities like you may see with removing a large volume of blood from a patient at any given time. So that's been a great point for us too, as well, with this technology, something we've really been able to harness and utilize here for the better. And I want to talk too a little bit about just the technology itself and how we can really use it for other areas. And so, we've been talking up to this point about treatment of sepsis, but there's also the opportunity to use our technology for helping with diagnosis of sepsis, more of like a diagnostic aid. Because if you think about our technology, what we're doing is we're capturing and concentrating what's of interest, in this case, bacteria. So what we've been able to do is we've scaled down our technology in size, and made this technology into also a small spiral type channel that can fit at any given time about 1 ml of blood. And what we've been able to do is isolate bacteria from blood samples and use that for rapid identification. And I can just kind of show a schematic here of how this works for us. So you would take a blood sample, 10 mil Vacutainer, flow that through our device. And what we do is we, again, using the same technology, inertial force and our ligand, we capture the bacteria along the walls of the channel. But the blood that comes out of the outlet, in this case, you actually discard that, because what you're interested here in the diagnostic aid scenario is the actual pathogen. So after you discard the blood, then the next step is you flow a buffer that we've developed through the device channel, which allows you to actually elute the bacterial DNA. And then what you have is you have a clean sample of bacterial DNA that you can then run on PCR. And you can do this without the need for culturing. So we could potentially here with our technology save this huge window of time by going straight from a blood sample in a Vacutainer to PCR, and eliminating or reducing that culture period. And this is one scenario of the diagnostic aid use, but it could be used in other scenarios. I mean, you could capture things like circulating tumor cells, potentially used for capturing viruses, things of that nature. This technology is very versatile. We're focused on sepsis and bacteria now, but in the future, there's certainly other opportunities. And so I just want to share what we've done kind of from the beginning up till now. So we started in 2017, late 2017, early 2018, and kind of how we got our start is I mentioned before, we kind of came up with the early idea. I came up with the idea while I was in grad school. But before I defended from grad school, I submitted a grant to the NSF for phase 1 STTR. And it just so happened that as soon as I defended we got word that we were being awarded that phase 1 STTR, and that's what really kicked off the company. It was pretty incredible how this all happened. It was really great, and really the NSF funding is what really helped start the company. And then on top of that, as soon as we got word that we were getting that phase 1 grant, we committed to a medical device accelerator program in Memphis, Tennessee called 0 to 510. And we're beyond thankful that we went through that accelerator program. It's a 3-month med device focused program in Memphis, Tennessee. And that's really what taught us, all of the business side of things that we had to learn for running the company. And it really this accelerator introduced us to all of our investors, and it's just been so important to us. It really helped kick off the company, honestly. And we can't say enough about how good that 0 to 510 accelerator program was for us. And after we went through that program, we were developing the technology with the phase 1 grant. And then in 2019, we learned about JLabs, and we really did need at that time a really advanced lab facility for further development of our device. And so JLabs in Houston offered that to us, and we saw the facilities at JLabs. We were blown away. They're just world-class facilities at the JLabs site in Houston. And so we really wanted to be part of that. And so we actually moved the whole company to Houston from Nashville to be in that facility. And we're still there today. We love it. And also, since we moved to Houston, we got to take part in the TMC Accelerator program, which was also a really great experience. It connected us to a number of people in the ecosystem in Houston. It connected us to a number of hospitals, clinicians, connected us to Houston Methodist, and gave us a great in there. So we were really happy with that program and being able to go through there. And then moving forward, in 2020, we got breakthrough device designation from the FDA, which has been vital for us. Like I mentioned previously, it was really important for us to have that designation to help develop our animal studies properly and in accordance with what the FDA would want to see there. And so that has been really helpful. Our group at the FDA is really collaborative and always helpful in all of our sprint discussions. And so we can't say enough good things about that. And being able to have that collaborative relationship with the FDA, it's been vital for us. We also won the J&J Quick Fire Challenge. We took part in Mass Challenge in 2021. We also took part in MedTech Innovator, which was also huge for us. MedTech Innovator connected us to groups, different larger corporations that will potentially, have shown some interest in the PathX technology and excitement. So that's been really, really helpful. And we completed our large animal study, safety and efficacy, which has been great. We also are on a phase 2 SBIR right now, a phase 2 grant with the NSF. And, that non-dilutive funding has been really, really great support. And so now what we're doing is we're getting everything in order for our first in human study. First in human study will be a safety study that we will do. And so at this point, we're getting all the documentation ready for that, getting all the biocomp squared away, sterilization, validation, those sorts of things. But that's the rundown of PathX and our technology. Really glad to be able to share that with you, and we'd love to have some questions, and more than happy to try to answer any of those. And again, really, really thankful for this opportunity.
Well, thank you, Sinead, for that very insightful, elegant overview of your technology and your company. I mean, it really is fascinating. I think what you've achieved in the last 4 years is just incredible, since you got that phase 1 there.
Sure.
I'm going to dig around in the technology a little bit at the moment, because very interested in it. So you use inertial forces, okay? And you're able to separate these bacteria, but can you maybe just talk about how do you kind of resonate, like how do you get the size selective component? So, why aren't the blood cells moving out of that flow? You're saying the small molecules, the drugs, that they won't come out. So it seems like there's a bit of a filter effect where you're targeting right exactly what you want. So can you maybe comment on that?
Yeah, definitely. I can comment on that. So you can utilize in these spiral type channels or helical type channels what's called Dean forces, and you can use Dean forces to focus and separate things in flow in a helical channel. In our case, based on size, and so in doing the calculation and in designing the channel, what you have to really take into consideration is what is the diameter, what is the average diameter of the particle of interest that you're trying to focus and separate towards the outer wall of the channel. And you can use that number, that diameter, and then calculate what the aspect ratio of the channel should be in terms of height, width, length. Obviously, you have to take into consideration what your flow rates are going to be, what the range is going to be of the flow rate that you wish to achieve. And taking all those things in consideration, you can use Dean forces and inertial lift forces to focus something of the size we're interested in, bacteria, along the walls of the channel. But that isn't the only piece. We aren't interested in only pushing bacteria along the outer wall so that they come in contact with the wall. We're interested in binding the bacteria. So what also is really important for us was the development of our ligand. That we have two ligands to bind gram-negative bacteria and endotoxin, and then also to bind gram-positive bacteria. And we had to develop that in. It wasn't an easy task. That's for sure. It took a lot of time to figure out how to do that. And even if you think about it, how to effectively functionalize the channels, how to effectively coat the channel with those ligands. And so that was a huge piece too that we had to figure out, which we were able to do effectively. And it works really well, but it was certainly a process to develop all that.
And just, it's been a while since I've really got involved in physics, but just so I've got it right, for an inertial force to happen, you've got to have an acceleration or a deceleration, right?
Yes.
So does that mean if you had a patient, say, on an LVAD, where they have a continuous blood flow, that this might not actually work for that patient?
Well, so our flow rate range for our device is very specific. So I want to mention that our device can be used in series with a hemodialyzer. The reason that we designed our device that way is that the second leading cause of death in hemodialysis patients is sepsis. And so these hemodialysis patients are commonly hooked up to a hemodialyzer, but we've designed our device in a way that can use a flow rate that is very comparable or the same as what you would use on a hemodialysis patient. So our device connects, upstream of a hemodialyzer in those cases. And with that said, with our device, you have to be able to achieve a flow rate of 80 mils per minute up to 300 mils per minute. And so, you have to be able to use a dialysis machine with the correct blood lines to operate our device, if that makes sense.
Yep. And going back to your diagnostics as well, I was just wondering if maybe it'd be kind of ironic if at the very end you could find a use for your iron oxide as maybe a binder or like a kind of imaging agent or magnetic separation, just by chance, have you looked at like a nano diagnostic platform? I mean, with the laminar flow devices for COVID-19, I mean, they're all gold nanoparticle based, right? So I wonder if there's maybe room for iron oxide.
So, no, it's a great point, and we thought a lot about this. What we could do, I mean, in theory, is we capture the bacteria, and then we could have a magnetic nanoparticle, or even maybe a quantum dot, whatever that was fluorescently labeled, and then you could basically image that and determine what's there, if something's there, if something's not there. The only thing though with that is, in these cases, in the case, for example, of the diagnostic aid device, the amount of bacteria sometimes that you will have available is so small that to get a signal from maybe a fluorescently tagged, fluorescently labeled particle would be very difficult. And so that's something that we've been exploring. It's definitely not easy to achieve. We don't think it might be possible, but up to this point, we haven't been able to do that. Now there's the opportunity maybe of using the iron core particles to, tag the bacteria and then magnetically pull them out. But again, like I was saying before, that magnetophoresis is limited with iron oxide core nanoparticles. And so you might not pull down all of the bacteria 100%. And in the case of a diagnostic aid, when you have very little bacteria, I mean, maybe 1 CFU per mil, maybe, then you're getting to a really small number there. So it's kind of limiting. So that's why we've taken the approach we have with the diagnostic aid, where we capture the bacteria, lyse the cells, run it on PCR quickly, which in that case is only, total from starting with Vacutainer to end of PCR, you're looking at 3 hours. So it's pretty small amount of time compared to what you'd see with your standard culturing.
And could you maybe just comment on how the device interacts with the patient? Like how is the patient hooked up to this?
Yeah, so patient is hooked up the same way that you would run, say, CRRT or run dialysis. So, you need a double lumen catheter. The device is hooked up actually to your normal off-the-shelf dialysis bloodline. So you connect bloodline to the inlet, bloodline to the outlet bloodline runs back to the patient, and then you start your treatment. Obviously, before you hook up the device, the device itself is primed. It must be primed in the same way that you would a hemodialyzer, just primed with saline, and then you start your treatment. But it's a very simple setup. It's if you look at our IFU and then look at the IFU of a dialyzer, they're pretty much they look very, very similar. There's not many differences there.
And in your first in human studies, I guess my question is, what kind of patient cohort are you going after, and how long will the patient be interfacing with this device?
Yeah, so the patient cohort that we're going after, well, I should start by saying this is a safety study. With the first in human study, our primary endpoint is safety. And what we'll be looking for from patients from the inclusion perspective are patients that are suspected to have bacteremia. They're showing signs of SIRS. They have an elevated procalcitonin level, those sorts of things. And in those scenarios, then as long as the patient meets our inclusion criteria, exclusion criteria, we can enroll them. But we are looking to primarily get safety data out of this. But on top of that, for a secondary endpoint, we will be collecting blood samples, culturing them, so blood samples from before the device and after the device, to show an improvement and a reduction in the total amount of bacteria in the bloodstream. Alex, did you want to add anything to that piece?
No, that's exactly right, and I think it's important to note that these are the same things that we've done in our animal studies. These are the same tests we've done. We've measured all of this safety data both on the bench and in the animal models. And like Sinead said, our primary goal is safety. However, we do believe it is important to gather some efficacy data as well before going into our pivotal study, because ultimately, how this device will be judged and what we want to see is how this will positively affect patients in the clinical setting. And I think for a device like that's really the key element, is how septic patients are going to clinically improve with this device.
Got it. And yeah, I guess I'll switch gear a little bit on the questions before we start getting questions from the audience here. But I always love to hear stories from the other side of the kind of the glass bowl, whatever, from the startup side. They're here at the TMC. It's so exciting. Like the last kind of 6 years have been tremendous. So what kind of affects your decisions to partner with institutes here in the TMC, and what's been your kind of experience so far with that?
Yeah, it's been incredible. Like Sinead said, we made the conscious decision to move the company here to Houston. And right off the bat, you can see when you go into the member institutions and when you talk to the key opinion leaders, how comfortable they are with innovation and with startup companies, and with accepting things that a lot of other institutions wouldn't be comfortable doing. And so, those are the primary impacts that you see immediately when you come to the Texas Medical Center. But above and beyond that, it's also the industry that's built around this incredible center. So, as a medical device company, there are a lot of things we need that are ancillary to our studies or our data. We need regulatory help, we need quality systems help, we need engineering help. And all these things have been kind of built around this incredible ecosystem that allow companies to come in and gain so much knowledge very, very quickly. One of the first experiences we had here is we've spent a lot of time in other places trying to get into hospitals and meet with executives and clinicians about doing studies, and it was a bit of a challenge sometimes. But as soon as we moved here, I think the first hospital we met with was Houston Methodist, and we had a great experience with them. We've worked with a lot of people within the institution. It's been incredible how open they are to innovation and helping us, and even indirectly helping us, even though it may not directly benefit them. They're always open to answering questions and helping us in any way they can. So I think it's a pretty special place, and for startup companies, it's a huge advantage to be somewhere like Texas Medical Center.
That's fine. And I'm just curious, who are you working with here at Houston Methodist?
So we've worked with Homer Quintana. He kind of, he runs the show. He helps us do everything. But also Dr. Long. We worked with him as well. He's been incredible. He's, especially from the diagnostic standpoint, he's extremely knowledgeable. So, and there've been a number of others as well. A number of people in the veterinary group and the animal groups as well.
So just for the audience here, I actually had Homer Quintano on the show here last year, and he is program director for the Center for Rapid Device Translation. If they're interested, we do have an Innovation on the Loose show in our archive on YouTube that you can go and watch and learn all about Homer and his work, etc. I guess obviously with COVID being so prevalent, could you see this being used, or maybe have been used for COVID, either diagnostic or treatment?
Yeah, definitely, and that's something that we've looked into. I mean, if you think about our technology and our device, I mean, you can alter obviously the aspect ratio of the channel, and you can functionalize the channel walls with a variety of different ligands. You could possibly use an ACE2 antibody to target and capture, be used for COVID. And so we've thought about these things. There's definitely applicability here, but we are a very small company. We're a startup company. We have limited bandwidth, and so we can't be flying all over the place trying to tackle a number of different problems. We've made the decision to focus on sepsis and targeting bacteria and endotoxin removal at this time, but that's not to say we won't do other things in the future, but at this point we are focused on sepsis. But certainly we can use our technology for other things. I mean, even capturing and removing circulating tumor cells. I mean, imagine functionalizing our channel wall with anti-EpCAM antibodies and targeting tumor cells that way. I mean, there are a lot of different options and different opportunities to use our platform when the time is right.
Got it. Okay. We're getting questions from the audience. Tell us about the TMC, like JLabs, etc. I know we've covered that, but is there anything else you'd like to mention about the TMC? I mean, what we're really trying to show here is, where are we different, or how are we different compared to like the East or West Coast, and why would startup companies want to come here and join the ecosystem?
Yeah, I mean, to kind of add to what Alex was saying, I mean, I have never been somewhere where there are, a number of hospitals just a stone throw away that you can go into and collaborate with on your projects and are open to innovation and that sort of thing. I mean, that's really I feel like that's unheard of. That's not really available in other places that we have been, and I'm not familiar with other areas being as open as they are here. to innovation. And then on top of that, you know, I did my PhD in biomedical engineering at Vanderbilt. I'm very familiar with the academic setting of research, and I can tell you that, you know, if you walk into J Labs in the Texas Medical Center, I mean, you'll be blown away by the facilities and equipment that they have. I mean, it can be even above and beyond what you would see in a very high-end academic research institution. And so having all these things available to a company is not common. And so that was a huge driver for us to come here. I mean, Dr. Long at Houston Methodist has been so collaborative with us. I mean, he's helped us along the way with you know, developing the study for our diagnostic device. You know, we have an IRB in place with him. I mean, you know, and he makes collaboration very easy at Methodist. And so we're just really happy to be here. And I don't think we would get this really anywhere else. At least in our experience, we haven't had that opportunity anywhere else.
And you know, for the audience, I'm just curious, what's been your biggest pain point so far? Like, have you reached a point where it was like going to go yes or no? I mean, thought about, you know, ringing that bell, I guess. Yeah,
Alex, why don't you go first?
I think we're have been pretty fortunate up to this point. We haven't been at the sink or swim point here quite yet. I'm sure that'll come, as it does with all startup companies. But obviously, we've had a ton of challenges. You know, you couldn't talk about this without talking about how the pandemic and how COVID has affected probably every single startup right now, from fundraising to the supply chain. You know, all of our devices are injection molded. Almost all of our parts are made overseas. There's a huge delay in materials and in processing, and that affects us. But we've tried to do things in a way that we can make the best out of situations. So, for example, during the height of the pandemic, we were kind of in the middle of our animal studies, and it was something that we had to get done. And although it was a really tough time for us and others, one benefit that we did have was big companies weren't able to travel and weren't able to go to these animal facilities to do their studies. And us being a very small company, being, you know, just a few people, being very careful, we were able to get in and get things done that typically would have taken months longer to do. So, you know, when you're in a startup, as a lot of people know, there are a lot of downsides, but what you do is you work to maximize kind of your mobility and your agility and do things maybe a little bit quicker than larger companies can do. So we've tried to take the negatives and turn them into positives in any way that we can.
That's great. And Sinead?
Yeah, I mean, obviously I completely agree with what Alex was saying. I mean, we've had material delays, like I'm sure a lot of companies have had, with our parts coming from overseas, and not even that. I mean, if you think about, you know, all the testing that we have to do between biocomp testing, sterilization validation, packaging compliance testing. I mean, all of these companies that you have to work with to do these tests they're all backlogged. They're all behind. Everyone is behind because of the pandemic. And so then we feel that as a company, because, you know, we have a difficult time getting our testing done as quickly as we want to. But, you know, it's just part of the world right now, and how things are, and everyone's dealing with this. I mean, what we're trying to do too is do as many things at once that we can, and really try to work in parallel with different testing and developing different procedures. So that's what, you know, that's kind of the approach that we've taken to try to kind of combat some delays that people have been seeing.
That's a great attitude, guys. And I guess the final question really is, you know, what's kind of next? You know, what's really down the pipeline? What's the big picture for you guys? Like, where will you be in 2025 or 2030? seems years away.
Yeah, well, it's tough to predict the future, but you know, there's been no new drug developed or new treatment option developed for the treatment of sepsis in, you know, the past 50 years. So we really believe in our technology and that we really have a breakthrough here. And so for the future for us, you know, our goal is to see our device, our technology commercialized. So like we were talking earlier about, we're going to do our first in human study, and then after that, obviously we'll have to do a pivotal study. Really, the end goal here is commercialization, get our device to patients. That's what our goal is. I mean, no matter how we get there, that's what we want to see. So that's what we're working towards. And obviously, it's a long road. You know, our device is a Class 3 PMA, but you know, we really believe in our technology, and we believe we have the tools to succeed here. And so we're going to do everything we can to get this device to patients.
Excellent. Well, I think on that note, I'd just like to thank you both again for appearing on the show. I mean, you've been absolutely fantastic. You know, again, really insightful, kind of elegant, well articulated kind of overview of what you guys are doing. I think it's absolutely fabulous, and really looking forward to seeing where you guys are going. And yeah, thank you very much once again. And
thanks so much.
And to my audience, you know, thanks again. You know, we've been here with Sinead and Alex, PathX Purifying Life. So on that note, I will wish everyone a good evening and see you next month. Goodbye.
Thanks, Stuart.
Thank you.